I am here at the Wildwood Preserve Metro Park in Toledo, Ohio, and check out the view. We actually started in Cleveland, Ohio, and I was originally going to record there, but we started super early this morning and it was too dark to record. So we are here in Toledo, but you're not here for the travel side of things. You are here to learn how Medicare works in Ohio, so let's talk about that. Leading up to Ohio, we've had a lot of states that have a bunch of exceptions to the regular rules of Medicare, but Ohio is a mostly normal state with one big exception. So let's talk about the supplement plan side of things first to understand that big exception. When talking the supplement plan side of things, we're always looking at costs first. So nationally, if a 65-year-old were looking to go on a Medicare supplement plan, your average cost would be at about $150 per person per month. Here in Ohio, the average is less than that at only $135 per person per month. The average for a Plan N would be $120 per person per month. Here in Ohio, it's $100 per month. So you're looking at a little bit lower than average costs here from a supplement plan perspective. A few reasons for that. Number one is that you will have attained age plans here. Remember, there are three ways that supplement plans can be rated. The first is community rated. It doesn't matter what your age is. So a 65-year-old pays the same as a 105-year-old. In community rated states, the premiums are usually the highest. Next is issue age. This is based on when you are first issued the plan when you go on Medicare. So if you're issued it at 67, you're paying a little bit more than you would have if you would have started at 65. That's kind of the middle cost for a 65-year-old. And then the lowest is attained age. Now, attained age plans are unique in that, yes, it depends on your age when you get the plan, but also rates will go up based on the age that you have attained. So if I go on Medicare for the first time at 67, I take a supplement plan, I'm going to get a 67-year-old's rate. But when I have a new birthday and turn 68, I've attained a new age, and we sarcastically refer to this as the happy birthday increase. So you can see a little bit of a bump because you've attained a new age, meaning a little bit of bump in your rates, a higher cost because you've attained a new age. On top of that, there's also a bump that insurance companies give every year that accounts for rising healthcare costs and inflation. So with attained age plans, you could see up to 2 increases per year because of the way that these are structured. Now with issue age plans and community rated, you'll see the one increase for rising healthcare costs and inflation, but not the increase because of your birthday while on the plan. But again, attained age plans start lower, especially for 65-year-olds, which is why you see lower than average rates here. Now on top of those already low costs, there are opportunities to get discounts. One of those is called a household discount. So let's, for example, say that me and my wife are on a supplement plan with the same insurance company. There are insurance companies that will say, hey, you know what? We're going to give you a discount because you're both with us. Another discount is called a wearable discount. That's if you're willing to wear a smartwatch like a Garmin, a Fitbit, an iWatch, and then sync it with the insurance company. There are companies that are willing to give you discounts to show that you're active and exercising. A third discount would be an annual discount. This means you're willing to pay all of your premiums up front for the year rather than month to month. There are insurance companies that are willing to give discounts for this. And on top of that, there are some insurance companies that are going to stack those discounts. So you could get all three of those with certain insurance companies. Again, I'm always harping on using an independent agent who's licensed and familiar with your state so that they can find you a supplement plan that meets your budget. On top of that, they can put you with an insurance company that's reputable and has a little bit more stable increases. And then finally, they can find you these discounts. And it never costs you to use an agent. I'm not even saying use us, use somebody else, use our competitors. Just use an agent to help you with this decision. If you do want our help, I do have partners who are licensed and familiar here in Ohio that can help you. My email address is in the description, or you can reach out at theretirementnerds.com. Now, the big unique exception here in Ohio is that you are a MOM state. That's MOM. It refers to Medicare overage measures. And these are put in place so that doctors and facilities cannot overcharge you. Now, you need to understand the 3 types of providers to understand this rule and why it's so great. The first set of providers are those who participate with Medicare. They agree that Medicare's payment schedule is going to pay for their services 100%. This is the vast majority of providers. The second level of providers are non-participating providers. They do not agree that Medicare's payment is 100%. So they have the opportunity to charge up to 15% more than the Medicare allowed amount, and you would be responsible for that. Now, with every supplement plan, with the exception of G and F, you would be responsible to pay those excess charges, is what they're called, out of pocket. So this middle group of non-participating providers is where the MOM rules come into effect. Now, the third group of providers are those who have completely opted out of Medicare. They will not bill Medicare. If you want to go use them, you're going to be paying them cash out of pocket and not through Medicare. But it's that middle group that we're focused on here for MOM charges, because in Ohio, they are not allowed to charge excess charges. So this is where Plan N becomes a little bit more popular. Remember, Plan N does not cover excess charges. Plan G does, but Plan G costs more. here in Ohio, Plan N becomes more popular because you're not going to be charged excess charges as long as you're receiving care in Ohio. So with this MOM rule, it's based on where you receive care. It's not where you got your supplement plan. So for example, if I got my supplement plan in Ohio and then I went to Texas to get surgery, well, Texas is not a MOM state. And if I went to a non-participating provider, I could see those excess charges. However, if I got my supplement plan in Texas, but I wanted to come to the world-renowned Cleveland Clinic for treatment, because I'm in Ohio receiving treatment, I am covered by the MOM protections and I wouldn't get those excess charges. And Cleveland Clinic is a participating provider, but if they weren't, and I did visit a non-participating provider that could bill those excess charges here in Ohio, they couldn't. So again, it's based on where you receive care. One minor tweak on this MOM conversation is that it does not apply to durable medical equipment. So if you're going for something like a CPAP, oxygen, prosthetics, the excess charges can still be applied on durable medical equipment. So make sure that you're visiting participating providers for that. There is no cap on those. Ohio is not what we call a GI state or guaranteed issue state. What this means is that in Ohio, if you're on a supplement plan and you want to switch to another supplement plan, maybe with a different company, or maybe you want to switch down from G to N, you would need to go through medical underwriting. What this means is you're answering medical questions, and if you have good health, the switch shouldn't be a problem at all. If you have poor health, you could be charged more than normal, or you could be denied completely. So here in Ohio, switching from one supplement plan to another isn't as easy as some states that have guaranteed issue rights. Now, this is just talking about supplement plan to supplement plan. I'm going to talk about supplement plan to an advantage plan here when we get to the advantage plan section. But to wrap up the supplement plan section, let's talk about the penetration rate of supplement plans here in Ohio. Now, nationally, the average is 21%. So 21% of people are going on a supplement plan. This includes all letters as opposed to something else like an advantage plan and other options. Here in Ohio, it's 24%. So you're slightly above the national average when it comes to the number of people picking supplement plans. That could be attributed to the lower costs, the MOM rules, and the ability that Plan N works really well here. All right, now let's move over to the Advantage Plan side of the conversation, and we'll just pick up off of the penetration rate. Nationally, the penetration rate for Advantage Plans is 50%. Here in Ohio, it's 54.5%, so a little bit higher than average in terms of the number of people who are picking Advantage Plans as opposed to other options. Now, you'll notice that the 54.5% and the 24% does not add up to 100%. That means that you have people who are taking either Original Medicare only, FEHB, VA benefits, TRICARE for life. It could be some sort of an employer arrangement. So that's why the number doesn't add up to 100%, because there are other options outside of just Medicare Advantage and supplement plans. When talking Advantage plans, a big number that we look at is the maximum out of pocket. Now, nationally, the average max out of pocket for Advantage plans is $5,000. Here in Ohio, the average is $5,500. So you're very close. These are averages, so you will find plans that have higher maximum out of pockets and plans that have lower maximum out of pockets, but that is an average for you here in Ohio. Now, earlier I talked about switching from supplement plan to supplement plan and how it's important to understand the difference between Advantage plan and supplement plan. So let's talk about that here. You follow the same national rules when it comes to switching from Advantage plan to supplement plan. What that means is that there are 4 things to talk about here. 2 of them are trial rights. Trial rights refer to your ability to try an Advantage plan and the opportunity to switch back to Original Medicare and a supplement plan with no medical underwriting. So the first trial right is if you go on Medicare at your 65th birthday. This only applies at your 65th birthday, not afterwards. So if you go on at your 65th birthday and you take an Advantage plan, you have a 12-month window where you can try that Advantage plan. If at any time within those 12 months you want to switch back to Original Medicare and a supplement plan, you can do so with no medical underwriting, no fear of getting denied. The second trial right applies when you go on Medicare at any age. So this one's not around your 65th birthday. So at any age, let's say I go on at 67 years old and I take a supplement plan first. If that is the case, then if at any time in the future I want to switch off of that supplement plan and onto an Advantage plan, I have a 12-month window to try that Advantage plan. And again, if at any time in that 12 months I don't like it, I can switch back to Original Medicare and my supplement plan with no medical underwriting. So those are your 2 trial rights. Again, this is nationally. This isn't just Ohio. This is just the national rule around trial rights. The third thing to talk about here would be a special election period. The most common for this is if you're moving outside of your coverage area. So there are special election periods that allow you to switch from your Advantage plan to Original Medicare and a supplement plan with no medical underwriting. Again, moving is most common. Another one is that if your Advantage plan insurance company takes that plan out of the area, then you're obviously left without a plan in that instance, and you could switch back to Original Medicare and a supplement plan with no medical underwriting. So I get comments all the time of people saying, oh, the Advantage plan insurance companies can just leave the area and you're totally left without coverage. That's not true at all. First, you get a huge warning from them. It's not just an immediate thing. They give you months in advance warning. And then you do have a period where you can switch to another Advantage plan easily, or you can get onto Original Medicare and a supplement plan with no medical underwriting. So that isn't really a negative in my mind for going the Advantage plan route. Again, this isn't me saying you should or shouldn't do an Advantage plan. It's just trying to clear up a myth there around that. Now, if you're outside of your trial rights and you're outside of a special election period, then your other option to switch from an Advantage plan to a supplement plan would be to go through medical underwriting. Again, you're submitting your health questions, and then if you have good health, you'll be able to do it. If you have poor health, then you could be charged more for that supplement plan than somebody else your age, or you could be denied completely. So those are the 4 ways to switch from Advantage to supplement plan here in Ohio. All right, I like to finish all of these videos with a secret word that if you leave it in the comments, then you and I can both know that you've made it this far. I can take the comments a little bit more seriously. And when I think of Ohio, as a kid, I remember watching the Drew Carey Show and the song that talks about Cleveland rocks. So if you just want to throw in your favorite TV show or TV series into the comments, then you and I can both know that you've made it this far. Look, I appreciate you making it this far. Please subscribe if you haven't already. It helps more than you know. I do, again, have partners licensed and familiar with the plans here in Ohio. If you do want help with either supplement plans or Advantage plans, or again, even if you don't want to use us, just make sure you're using an independent agent. We're going to go explore this area a little bit more. I will see you in the next video.